All right. Hi, everyone. My name is Christy Lafferty. I'm the Development Director here at AMOS, and we've finally gotten the technology to work here. We're so excited to be able to share with you an update of a lot of the different things that have been happening so far at AMOS this year in 2015. I have several other staff people with me that I'll introduce to you in a minute as we go through the presentation, but I just want to thank you for being a partner with us, for helping us serve the people who are most vulnerable here in Nicaragua, and working together with communities to help improve their health. So I'm going to go ahead and share a presentation that we've prepared for you. Like I said, thank you so much for being partners with us. This is actually a photo that was taken during our partners gathering last year in September. We had representatives from about 12 different church and university partners who joined us, and this was part of their trip to the community of La Consulta. Tonight we wanted to share with you, just go over the agenda for tonight. We're going to share with you who is joining us on this call from the AMOS staff. Wanted to just share a little bit with you about why your support specifically as AMOS partners from churches and universities is so critical to our sustainability as an organization. Also talked about what AMOS is doing to look at women's health in a holistic way. Talking about a very special program that's starting this year in the RAS, in the region of the RAS, called Helping Babies Breathe. We're going to also share a little bit about our global health interns that'll be joining us this year and the research they'll be helping our rural health team do. We'll also mention a little bit about the community health model that's being developed here in the community of Najapa, which is more of an urban setting compared to the rest of the rural communities where we work. John with our delegations team is going to talk about some exciting projects that are new and being developed to implement this year with our teams and with our communities. And then we're also going to share a little bit of an update related to our filter program, our clean water program that's helping thousands of families now have access to clean water in their communities. And finally, at the end, we'll have a short time for some question and answer and let you know a little bit more how you can get involved this year. So everyone who's helping present tonight, Dr. Laura, who will be speaking first to you, is one of our AMOS co-founders along with her husband, Dr. David Parajón. Desiree is our volunteer program manager. As I mentioned, I'm the development director here at AMOS, and John is our delegations program manager. For those of you who may not be very familiar with everything about AMOS, I just wanted to do a quick review of what our name means and what our mission really is. AMOS actually has two connotations, two meanings. It's an acronym for a Ministry of Sharing, Health and Hope. And AMOS also refers to the Old Testament prophet Amos, who stood up for the poor and cared very much about trying to strive for social justice and breaking down inequities between the rich and the poor. And our mission, as it says here, is focused on improving the health of impoverished communities by working alongside them in health, education, and development. So just very briefly before I pass the presentation over to Dr. Laura, this is a little clip from our annual report for 2014, and I just wanted to share that all of you as members of churches and universities who are partners with AMOS, you actually help us to raise 56% of what is needed for our ministry to continue. So it's just your contributions. We could not be doing this work without you, and so we just want to thank you once again for being a part of this work. Okay, Dr. Lara, I'll hand it over to you.
Hi, so thanks for being on this call. It's me, Dr. Laura, and I'm also here with Dr. David. You want to say hi?
So,
I just want to introduce a little bit about our rural health team. I'm primarily, since I'm the medical director, I work with the rural health team, which is Anne-Marie here, Socorro, Patricia, Dr. Carlos, Anna, Gloria, Sylvia, and Andre, and also a new addition for our Essential Newborn Care Program, Kenya, and also Renee Kusler. Some of the exciting things we're doing this year are improving women's health. So there's a cervical education, cancer education and screening program that we started this year with Brenda from University of New Mexico and Emily. This is including some home visits for cervical cancer patients and also training people about the importance of getting pap smears, because cervical cancer is still the #1 cause of death, preventable death here in Nicaragua for cancer. And so a lot of the work we're trying to do right now with the women, from their needs, they have expressed that they want to share with other women the importance of getting their pap smears and getting followed up for that, because it's completely treatable and preventable, and we want to do something about it, and so do the women in Najapa and also in the rural communities. Also, another thing we found in the women we work with, a lot of them have talked about the trauma of suffering from domestic violence, and also from the trauma of everyday life of the violence, the structural violence of living in poverty all the time. And one of the ways to do this is through healing arts. So some of our co-missionary workers from I guess Mexico, sorry, because now from Mexico and from Bolivia and also from Seattle came down and worked with us to do healing arts with us. So as those of you who are American Baptists might know Mylinda Bates and Joyce Reed, and also Barbara Bolick, they came down and helped us do a healing arts training program for women in Najapa and also our rural communities. And now they're going to go out and replicate this training, and it's really a training to help women really be able to heal through the arts. It's a really exciting program, and we're excited that you can see this awesome picture of everyone being super happy at the training. Another project that we've received that's really exciting is a special grant that we've received from the American Academy of Pediatrics and UNC Chapel Hill with Dr. Cara Bose and Dr. Crystal Perez. It's a really exciting project. It's both helping babies breathe and also essential newborn care. It's the first of its kind to be implemented here in Latin America, so we're very excited about it. It's really focusing on training healthcare professionals at the Ministry of Health and also community health workers in the RAS, our most remote area that we work in, to prevent neonatal deaths. It's a whole way to use protocols and also make sure that there's quality assurance in training people to what to do when a baby's born, what to do if the baby needs to be resuscitated. So it's very exciting, and we're really glad that we get to be a part of this project. An overview of the program is that it's doing essential newborn care for babies when they first are born, and also helping babies breathe. This is just a quick little overview that you can get on our website also, but it's to improve newborn care and reduce newborn mortality. That's the most common cause of death is newborns in Nicaragua, so we're trying to prevent that. It's a 15-month timeline that we're doing. We just completed our baseline, so our whole team went out to the rural communities and collected information on what's going on right now. And then right now we're going to be training the moms and also all the workers in MINSA and the government health centers to be able to do really good newborn care. We're going to be collecting the data, and we're working in 34 communities in El Ayote and 27 communities in Santo Domingo. So it's really exciting because it's really expanding our scope of being able to help a really important problem, which is like neonatal mortality or newborn death. We're working with UNC Chapel Hill, the Ministry of Health, and also the university here in León, which is UNAM León. We're going to be training master trainers, regional facilitators, training of trainers, and also training our health promoters, volunteer moms, and traditional birth attendants to all be able to work together to really help the health of newborns and help them survive. Our expected outcomes is that maybe fewer babies are going to die because of this, we're hoping. We're going to improve exclusive breastfeeding, hopefully, in newborns, and also improve women's empowerment as they organize for improved health of women and children in their communities, and really working towards improved living conditions for people in rural Nicaragua. So that's our project. We'll share a little bit now about our volunteer program team with Desiree.
All right, guys, so I'm really excited to talk to you a little bit more about the volunteer program that has grown a lot in the past 2 years, I'd say. And I'm going to start talking about something that we're really excited about, which is the Global Health Practicum. The main objective of the Global Health Practicum is to create another part of our mission, or to work on another part of our mission, which is developing global health professionals. And I think it's very interesting for those that participate in the Global Health Practicum to learn about the different methodologies that we implement. What are the different strategies and interventions that we use, and why? As you know, we base all of our methodologies are evidence-based, and they're all tailored to our communities here in Nicaragua. So it's a great experience for those that are interested in public health, medical students, but also anyone interested in development, actually, in general, has an opportunity to understand basically the obstacles, but also the rewards of working in development, and and what your role is, and basically how you can take action to make change. So our practicum, we are actually having 2 practicums this year. Our first one is with OSU, Ohio State University, and we're actually in it right now. This is the first week of the practicum, and it lasts 3 weeks. And then the second summer practicum is with different students coming from different universities, and it's from June 8th to the 26th. So it's the summer practicum. You have the option of applying to the internships. And our whole volunteer program is basically based on how can we work with the rural healthcare team. How can we fit into their mission and their annual objectives? We don't want to be doing education separately. We don't want to be implementing new projects separately. We want to see how can we work with the existing programs at AMOS and basically give them human resources, give them these students that are eager to learn and help. And so we actually are offering 4 internships this summer for those that would like to stay longer than the 3 weeks of the summer practicum. And the first one is a Women's Empowerment in Nutrition internship. And I'd like to say this is women's empowerment not only in nutrition, but in health, actually, in general. And so these volunteers will spend a total of 6 weeks here, and 4 of those weeks are out in the rural communities. And they'll be working with a group of women in one of our communities, and doing different types of work, including research, looking at the feasibility of some of our projects, understanding the roots of some of our obstacles that we work with. Why are there so many children with anemia in the rural communities? Why are there mothers not going to hospitals to have babies? What are the economic and cultural barriers? And is what AMOS is doing the best approach? How can we modify it to reach more people? So we're going to see if we're going to be validating the educational materials that AMOS has, and by doing home visits. And so we're doing a series of activities to basically do some research and assessment to see if our implementation is the right approach and how can we improve it. The Youth Empowerment Internship, all of the internships are linked with the same objectives, but as you can imagine, this one's more focused to youth. And so we're going to be, again, focusing in a community that we work with, mostly in La Paz. We're going to be focusing this summer in La Paz. And here we'll have an opportunity to see what is the best way to implement the Youth Empowerment program. those of you that have visited Nicaragua know that depending on what region in Nicaragua you are, it's different. You know, you have to see the geographical dispersion. You have to see the access that people have to different things: education, health, right, electricity, and so the interns will have the opportunity to empower the youth on different topics. You know, train and educate them on different topics such as sexual health education, but also different topics that youth struggle throughout their lives, and then seeing what is the best way to implement it in the region of Barras. The Clean Water Internship, and I'd like to say that the Clean Water Internship and the Community Health Worker Internship are very linked. And what we're going to do is do data collection and analysis, basically going home to home and doing surveys to, again, try to get a better understanding of how are the filters being used? Are they being used appropriately? How can we improve the use of the filters, not only for the correct maintenance, but using clean water for other purposes than not only clean, like drinking water. And so we're going to be doing those home visits, as well as understanding what their knowledge and attitudes and practices are regarding clean water. We're really excited to link that internship with the community health worker internship because we'll be starting our first water promoter training in 2 communities in La Paz. So we are trying out and seeing if we not only have a health promoter, but also a water health promoter that focuses mainly on the water filters and other topics of education, such as hygiene and sanitation, visiting homes. As you know, to have a behavioral change, it takes time. So developing a method of supervision and follow-up that will be a little bit more consistent and sustainable to see more change than the one we've seen. So we're very excited about all of these 4 internships. It gives like I was saying, a great opportunity to learn for those that are interested in public health and development. I encourage you to promote these opportunities because they are a way to learn about community-based interventions and methods, always based on community participation. What does the community want? What do they consider they need? What are their strengths and weaknesses, and learning from them. And it's a great way to actually practice public health and development in general. So promote those opportunities. We really appreciate it. And I assure you it would be a great experience for them. So thank you so much. We're now going to go and start talking about the urban health program in Nejapa.
Hi again, it's me again, Dr. Laura. Hi. So the urban health program is something we're really excited about. I think as an organization, we've always wanted to be also able to do something for the community that we actually are living in. And so AMOS is situated in the community of Nejapa. And so this is an opportunity for us to take some of what we've learned in community health in rural areas and bring it to urban areas. The pictures you just saw were a lot of our health workers that we have now in the urban health program. And it's a little bit different, the urban health program, in terms of the diseases or issues that we're addressing. For instance, we're addressing chronic diabetes and hypertension, which is more prominent in the urban areas. But we're using the same community-based methodology. We're training community health workers. We're starting from a strengths-based approach. We're training community leaders to try to offer support to the most vulnerable people through home visitation. So in the picture you see here, one of our health workers is giving advice to one of the women in the community who is suffering from diabetes and hypertension. And then in this other picture, the health worker is supporting a woman who has cancer. And so there's a lot of support that the health workers in the urban areas can give to the people of Nahapa. In our urban program, we really want to try to provide comprehensive care, physical, emotional, and spiritual health, just like in our rural program. We did a baseline, and we found that actually 5% of the people we interviewed had diabetes when we did a big baseline study. Over 13% of the people had hypertension, but over 25% of the population was really at risk for having diabetes and hypertension. So that's a huge opportunity for us right now to be able to actually work with the health workers in the community. We had a huge amount of people who were suffering from obesity, and so that's a risk factor for diabetes and hypertension as well. So we had about 40% of the women in Nahapa were at risk for getting diabetes and hypertension. So a lot of the work that we're doing is really doing medical care. We have a clinic here, the Clínica Samaritano, that we have very low-cost health care for people, including medical, clinic care, pharmacy, laboratory, and ultrasound. In addition, we have a whole series of support groups for health education. So with the health educators who are the health workers that we work with, they're providing they're getting trained right now on how to do support for palliative care, for counseling, how to do home visitation, take vital signs, and also like support the Pap smear program with sexual and reproductive health in the communities. We also have support groups here, and those are really successful and really exciting to see people come together and really support each other in their healthcare issues. And so we have a pregnancy support group, a chronic disease support group, and a youth empowerment group. So those are the things that are going on in the urban care program, and we're really excited. We hope you can come and visit sometime to see that. Now we're going to turn you over to John.
All right. Hi, everyone. My name is John, and as Christy mentioned, I work with our delegations program alongside this wonderful team. So we have Carmen, Felicia, Melia, and Lester. So all of us work with coordinating the trips, and Lester works specifically with coordinating the community projects. All right, so I wanted just to share a little bit about something that's new that's happening within the delegations program. So this kind of new idea came up when we actually had a health promoter training here. It was one of our last ones. And we talked with the health promoters, and we're kind of brainstorming some different ideas with them of what they would really like to see. And a lot of them actually pointed out that they would really like to see more trainings at more of a local level in their communities for health committees and other community members. And they talked about things like basic first aid, which seems like was something really manageable for us. So in this year, we actually put together a few different pilot projects where we piloted with delegations to teams that came down that actually helped lead first aid trainings. And this was a really interactive, really hands-on training that the teams helped lead. And we invited some different community leaders and the health committee. And we really just made it a really fun experience where they were able to really learn. We did a lot of reinforcement so that they could learn things about how to treat wounds, treat burns. And then we also focused on how to transport patients. So how to get an injured patient to the clinic or out of the community if there's an emergency. So we really focused on those topics, and we saw some really great results. And I wanted just to share a little bit, I wanted to share a story. I'm kind of a storyteller, so I wanted to share about one specific example. Basically, in one of our last delegations, we went to a community called San Onofre, and we did this whole first aid course. And we had about 18 people that graduated from this course, and were able to do some basic first aid. And the team really had a great time. We all learned a lot. It was really fun. And one of the key things is that we really wanted this to be an empowering experience for the communities. Even just sharing that knowledge is empowering, but we wanted to build up the health promoter, and that the health promoter is someone that already knows this knowledge. We're not coming in and just doing something new, but we're sharing the knowledge that the health promoter does. So she was really involved with the trainings as well. And the idea is that with more people that know specifically about how to care for some basic wounds, they can do that in their homes, and they don't always have to go to the clinic in order to have every smaller injury be treated at the clinic when they could, and they could do it in their own homes. So that's what we focused on. And in this story, we completed the course. We had just completed it a matter of hours ago. So most of the women and the men that actually completed the course, they were there and they received their own first aid kit as kind of like a prize at the end and an incentive to come. So they had them all on them, and we had a community farewell. And we were in the celebration, and we actually heard word that someone in the community was injured. And it was a man that had a huge log or a huge branch fall from a tree onto his foot, and it really created a huge wound in his foot. And basically, we heard about this in the assembly, in the celebration, and we went out, and the health promoter went to this guy's house, and it just so happened to be that two of the women that had just graduated from the course already got there ahead of time, and they were already doing the steps to help care for this guy. They were already helping to stop the bleeding, and one of them already had her first aid kit in hand and was, taking out the soap and taking out, the first steps to help treat this wound. And it was really cool just to see that. And Timothea, who was the health promoter, she got there and she helped be able to really, bandage him up. And they knew that they might need to get him to a hospital or a clinic to be able to see if anything was broken. So they actually did this whole transportation plan, which was another thing that we had talked about. But the community already was organized. They already had their plan. And they brought out a hammock, and they actually prepared to be able to have this. Excuse me, I have a picture right here. So we had this hammock that they brought out, and they were preparing it to have this man be put into the hammock so they could get him out of the community, which is a difficult community to get out of because you have to go down a huge hill. And so they got him into the hammock, and as you can see, his foot is bandaged up there. And the community really came together. There was a lot of them that were supporting this, which was awesome to see how unified they were and organized and just quick to get this going. So they got him into this hammock, and they got him out of the house, and they started to go down the hill. And as they were leaving, I noticed that there was really no one else. It was just these two guys that were going down the hill. And I had just learned that day about how their plan and how their community works, and that they usually said that they have so much support, they send about 20 people to evacuate someone from the community. And I turned to Timothea, the health promoter, and I said, listen, these two guys are going down that hill alone. Like, if you need extra support, I'll help carry. I didn't want them to bear that whole weight by themselves. And she turns to me and she says, no, they're already actually have all the support they need. There's actually in teams of 2 that are stationed along the hill to descend. They had teams of 2 that were waiting to tag team and to take that weight of that hammock from these 2 guys that were carrying it at first. So tag team, they got the man all the way down the hill. And it was just a really cool experience to see how incredibly organized this community was. It was so encouraging for me, for the team, and for the community. We all shared in that. So it was a really amazing experience. And I just want to say that this this first aid training that we're doing, this was a pilot, and now we are really hoping to offer to other communities that want it. And there seem to be a lot interested, and offer also to teams that have some medical interests that want to help support in more of this type of work. All right, so on a different note, we also have our clean water program. And in this year, so far, we've installed 110 new water filters. And we really have a focus this year on filter supervision. So this means the filters that already exist, we want to really make sure that they are being cared for, and similar to what Desiree talked about in the internships, that we're really understanding and that we're supporting the families to be able to have clean water and to use it correctly, so that those filters really can last their life expectancies. And one of the things that go along with the internships is that we are going to be having 2 different water promoter trainings. This is a pilot that we are starting that Lester is working a lot, really hands-on planning with the communities for. And what the real idea is to really expand the knowledge of how to care for your filters into a lot of different members that will become water promoters. So, we have the health promoters in the communities, but now we're hoping to have water promoters that are, this is going to be divided by sector. There'll be multiple in each community, but it's really to help just increase that knowledge and really just work more hands-on in every sector, have someone that's a leader among the water filter program. All right, I'm going to turn it back over to Christy.
All right, thanks so much for sticking with us. We hope that you enjoyed that overview of some of the really exciting things that are going on so far this year in 2015 here at AMOS. Just one plug, if you all have not gotten a chance to take a look at our 2014 annual report, you can visit our website. That you can see the address right there, amoshealth.org/AR2014. It's a report that's full of more stories about the kind of impact that the work that you are all working to support is having in the communities that we work with. So we're really excited because we have a few great questions that were sent in to us that we're going to take an opportunity to answer here. And the first 3 questions, actually, we have some great questions coming from Bruce Vanderbeek, from our Mid-America team and from FUC Johnston. So I'm going to have Dr. Laura take a stab at the first one, but I'll go ahead and read his question. So he says, I just finished a book by Kenneth Morris called Unfinished Revolution, Daniel Ortega and Nicaragua's Struggle for Liberation. The author states that since he was elected in 2006, Ortega's key anti-poverty programs have been designed with the needs of women uppermost in mind. He cites 2 programs that have been part of this Ortega's term as president here in Nicaragua. But he says, politics aside, how do you feel the policies of the government mesh with the work AMOS is trying to do with women in the rural communities? So I'll turn it over to Dr. Laura.
Okay, I'll just say something briefly, and then I'll let Dr. David say a little bit about that. But basically, the government is doing some great policy things for women. It's just not always reaching out to the most remote rural areas. So we see ourselves as complementing their current policies and really trying to support women in communities.
The government has been implementing some of these programs, and we have seen some of them implemented close to the communities where we, like Dr. Laura said, the government does not have all of the resources it needs to do this in the entire rural area. So what AMOS is doing is working in areas where there's a great need. We see a government presence, but the work that we do is the most, how can I say, is in the communities where we are, there's not really a strong governmental presence of programs. The ones that we do see the most are with the Ministry of Health and MINSA. And we have a policy of trying to work in coordination with the government. We try to let them know what we're doing so that they can be informed, and also we try to support any major health effort that they might try to undertake. For example, they do vaccination campaigns, an annual massive vaccination campaign in the whole country. And in the rural areas, it's a logistical challenge to coordinate these. And in the communities where we work, our health promoters are able to participate in making sure that every single child will get the vaccines that the World Health Organization provides. The government, logistically, as you can imagine, getting vaccines to a remote community is very difficult. There's a cold chain involved, and then you have to have people who go to the villages. And so the health promoters do a wonderful job of making sure that this can happen. The beauty of the model of having a health promoter is that the health promoters are local, and so if, for example, a mother does not go and take her child or her children to get vaccinated, the health promoter knows and can go knocking on her door the next day and say, hey, why don't you come to the vaccination campaign? And if it weren't for somebody like that working there every day of the year that knows everybody, it would be simply impossible to guarantee a high coverage rate. So to answer the question, yes, the government is doing things for the poor. We cannot endorse the government, or we're an apolitical organization, so we cannot say that we favor them or any particular party. What we want to see are governments that are concerned for the poor. We want to see programs that do take care of them, and what we see presently is good in terms of the Ministerio de Salud. So we're happy with that relationship, and we appreciate the fact that the government actually allows us to do what we're doing, and they have told us they appreciate what we're doing because they recognize that there's a need that we are filling.
Great. All right. The next two questions are going to be directed to John. They're actually related to our delegations program. So many of you who are joining us for this call have come down and visited and experienced our programs and worked alongside the communities in the rural areas or here in Najapa. And so you've been a part of what we call our delegations program. And so Bruce wanted to know, if he's asking us as AMOS staff, if we could change one thing about the U.S. delegations that come to serve at AMOS, what would that be, and what do the delegations need to do to prepare better or to serve better? So John?
Yeah, so one of the things, and we talked about this within our delegations team, about what could people do to prepare in the best practice. And we talked about the monthly meetings that a lot of teams have is something that is really an incredible preparing experience, because it really helps to unify the team, helps to really relay all the information. We give you guys a lot of information. So knowing how to fan that information out and throughout the different meetings can be really effective. So not only just meeting monthly, but also having a really effective way to use that time is really important. And we've just heard a lot of really great advice from people. Even someone has mentioned that you can't sugarcoat it in the first few meetings when you're still recruiting people. You might have to be a little bit more blatant and say, you might want to scare people a little bit in the sense that be honest and say, you're going to be going out to some intense conditions. You're going to be going out to area there's no Wi-Fi, let alone electricity or running water in certain communities. And so basically to make sure people know what they're getting into, because if you recruit people that really don't have clear expectations and they're not really cut out for coming on this type of trip, it's going to make it a lot more difficult for the team, and you might see that might actually inhibit how your team serves in the best possible manner.
Great. And one more delegations-related question is sort of on the opposite end of things. So we've talked about the before the teams arrive and how can they prepare themselves better. The third question that Bruce had was, when delegations return to the U.S., the churches want to hear about the trip. What one thing do you want to be sure that churches hear from the delegation members that came to work here in Nicaragua?
Right. So we think that one of the most important things that churches can hear is your story. Really having your personal experience being relayed to them, it's something that can be really impactful, really powerful. It helps people to really, put those relationships that you've met, just even if you have photos or stories, just to share that, it really helps to really relay AMOS, because AMOS is really made up of all of these experiences that are combined together. So sharing your story is something that is really the most important.
And I'll just add something to that. I think that, our philosophy, something that we believe really, really strongly in related to our delegations program is that, this isn't just a typical, mission trip where you come down and you maybe work a little bit and you have a good time and you reflect, and then you go home and you might never think again about or be connected again to the people that you served. This is really a very intentional way of working that your delegation, your mission teams always connect into the long-term ministry that AMOS is continually developing in our long-term relationships with the communities that we serve. And so, you know, we really are so grateful for all of you, but we need you as well, because we're all here in Nicaragua. We need you to be able to share what's happening here, why you're inspired, and why this is such an amazing ministry to be a part of, and invite and ask other people to join as well, because as we continue doing this work, we can always use more people who are excited and want to become a part of AMOS and the ministry that we're doing here in Nicaragua. All right, I think we have one more question that comes from Carol Harvey from Episcopal Church of the Messiah in California. And she is asking a question more specifically about our water filter program. She wants to know and understand a little bit better. There's some families, she says, that she has been, you know, several times with her people from her church, the community of Comayque Norte. But many of there are some families that receive a water filter, and sometimes they aren't able to maintain it as well as we would hope. So she was asking, is there something that we can do as a delegation or a team coming to visit to help with this, or are there better systems that could replace the types of filters, or what is the issue? What's going on when we talk about some filters not always being kept up?
Yeah, so, well, one of the things to know is that different communities respond differently to the water filter program. In some communities, we've seen super, super high success rates where people still are using them for years, and they still have 90% of their filters that are still intact and still working great. Other communities responded differently. And one of the things that we've learned over the years is that some of it does have to do with just the really participatory leadership of the community. We've seen a link in that. And we want to focus and kind of harness in on that really increasing the leadership of people that really are caring for, having those leaders that are caring for the filters and really looking out for the sustainability of the program in their community. We want to really focus and build up those leaders. So that's what we're hoping for when we talk about the water promoters that we are piloting this summer. So we're only doing it in 2 communities. So it's going to be something that is going to be a long process to have every community be able to have really refined water promoters. But that's really the hope. And really through our water supervision process, which we do, we continually have been doing, we really want to build up. We really want to build up local leaders, the guides that go out with us to the homes and the individual home, the adults in the family. We want to make sure that they really understand. Just more knowledge really helps to make it successful in the program.
And maybe just one thing to add to that, with a lot of the health issues that AMOS is working on long term, to be able to, prevent certain more complex problems like anemia or malnutrition, a lot of this has to do with behavior change. And behavior change is just educating someone one time and asking them to care for the filter. There are a lot of different factors that lead into somebody maybe not taking care of their filter, or not eating the right foods or whatever. And so it is a long process, and that's why the long-term relationships is such an important part of what we do. All right. So we wanted to share, before we wrap up the call, just 2 quick ways that we wanted to share with you, ways that we're needing your support and how you can get a little more involved this year with AMOS. So you see a picture here of a couple. Their names are Cassie and Jordan. And Cassie and Jordan are actually professional videographers and photographers. And in 2011, Cassie and Jordan visited us, and they actually helped produce a series of videos, promotional videos for AMOS. One in particular that some of you may have seen many times, which is our AMOS identity video. And it's a really incredible demonstration of an introduction to AMOS. They are hoping to come back and visit us this year, later this summer, and we are looking for some people that can help sponsor their work with us again. We're needing to update some of our video content and material. And so if anyone is interested in sponsoring their trip and helping us bring them to work here with us at AMOS and producing some more videos that can help share and spread the word about what we're doing here in Nicaragua, we'd love to get in touch with you. So you can email communications@amoshealth.org if you are interested in supporting in this way. And also, I'll let John explain a little bit about an opportunity that there are just a few spots left for what we call our rural health immersion.
Can I just say one thing about Jordan and Cassie? The work they do is phenomenal. Videos they did were completely professional. They're recent graduates and just did an outstanding job. I can't think of a better couple of professionals to come back to AMOS to do really, really top-notch work for us. I don't know if you can support them or know somebody who can, but it's an investment well in a good cause, because they're just a great couple. So thanks, Christy, for doing this, and thank you if you can find ways to support them and coming back to AMOS.
Right, and to touch on the rural health immersion, so this is a program that we have defined. It's from August 4th to the 16th, and it's an opportunity for people that are looking for a little bit longer, it's just a little bit longer than a typical delegation, where you really go to a community and you really feel a sense of immersion. Because what we do is we do different programming, but we also do we focus a lot on being really integrated into the community. We're looking for people that really want to practice Spanish and just really dive in to understand. So the project with this is a health project. We are going to be working with training local women deeper in just women's health. So this is something that you don't have to be a medical professional, but if you're interested in the immersion aspect or in the health aspect, we really are looking for more people to participate in this. So if you're able to spread the word, we really want to see this this project be really successful. So again, if you know of anyone, that would be amazing if you can help connect us.
Okay, and just one final thing. This is a new kind of outreach that we're trying to do with all of you as partners, and I'm sharing more information about what's happening here at AMOS and really how your support is empowering us and enabling us to continue doing this ministry here. So if you have any feedback for the topics that we covered, any other focus or more specific ideas that you'd like us to include in a future recording or call like this, we would love to hear from you. So please email communications@amoshealth.org, that email on the screen, and send us your thoughts. So that basically wraps up our call tonight, and we just wanted to end the call by saying thank you once again.
Thank you.
And wherever you're joining us from, wherever you're watching this recording from, we want to thank you for your prayers as well, for keeping us in your thoughts. And we hope to see many of you soon, later this year or next year. So take care, have a great night, and we'll hope to hear from you soon.
Thank you.
Thank you so much.
Lucas.
God bless you too, and just remember you're supporting like with your short-term missions, long-term impact in Nicaragua. And just want to stress that it's so important to us. We love you guys so much. So bye.
Bye.